Minutes to, just an extenuation of our emergency session we had earlier this week. So Jay has before us, CIS is recommended for us to put a policy in place with some of the direction come down from the governor's office. So Jay, you want to give us, none of us have papers in front of us, but give us an overview.
Okay, so what this is a response to the Families First Coronavirus Response Act and the Emergency Paid Sick Leave Act. So both of these policies are temporary. They are effective April 2nd and they end December 31st unless something changes. But full-time employees will get 80 hours of COVID-19 paid sick leave. Now, this will be kept separate from their regular sick leave. So we won't be deducting from their sick bank for COVID-19 related issues. All of the definitions and the qualifying reasons are listed in the policy, but basically those who are quarantined or self-quarantined or have a diagnosis or treatment or waiting for diagnosis or treatment are going to get 100% pay without deducting their sick banks.
So just do we have to, courthouse is 37.5 hours, road department's 40, is this based on 40 hours?
It's 80 hours, yeah. So
80 hours, so.
80 hours no matter what, yeah. Okay. So some of those other reasons, the child care, caring for a quarantined individual, they're entitled up to 2/3 of their regular pay. So what we would do is we would give them those hours, pay them, and then they could choose to use their own sick leave or vacation to supplement and receive their full pay.
And so that 2/3 pay, if they're caring for the sick one, you're saying,
Yeah.
how long does that 2/3 go for?
Also, 14 days, right?
Up to the maximum of $2,000 and the 10 days, the 80 hours.
Okay.
And then the school closure part of this is just a little trickier. There's a lot of misunderstandings about it, but employees are entitled to time off to care for their child if the school's been closed. However, the first 10 days are unpaid. After that, they're entitled to 2/3 pay. And we're not deducting from their sick bank. And that's up to the following 10 weeks. So that's a long time. However, it's not
To
just,
clarify on that, when I'm reading through that on number 5, it actually says if the school or child care provider has been closed or is unavailable due to COVID-19 related issues.
right.
So-
So for someone to be eligible for this benefit,
Right.
their child care provider would have to be unavailable due to this medical emergency. What do you
Yeah,
call
it
this?
wouldn't just be the school closure, but also
Right.
that they would have no other means to take care of their child.
Right.
And they have to be the primary caregiver also.
Yeah, so if their regular child care provider was grandma and they didn't pay her, they wouldn't be eligible for this benefit.
Right.
So if an employee comes and wants to use this benefit, and they're not bringing us a note from their child care business that was closed due to this coronavirus, we would have the right to ask them, okay, who is providing this child care? Are you paying them? And in order for them to qualify for the benefit, it would have to be someone that was paid that wasn't a relative.
So as we will plan and if we adopt this, and there's questions to be had, all those will go to your department.
Yes.
And then you'll do all the guidelines, follow all the guidelines, and ask all the questions, get the documentation.
Yeah, and it gets tricky. Some of these, one of these definitions is substantially similar care. We're expecting a better definition from the the Labor Department on what that means, but, so.
Yeah, that was my next question, because it's super vague, and I honestly just did not fully understand it. So,
Yeah, and so honestly, at this point, if somebody came and asked about that, I wouldn't know how to respond exactly. But we're expecting more help with that in the next week or so.
So,
excellent.
so with that said, is it recommended to go ahead and adopt this policy now, even with questions from Boley and everything?
Yes, this is
Because
basically reiterating the laws that we're required to comply with. And this is the best of our understanding at this point.
And it takes effect April 2nd.
Yeah.
Which is Thursday, so if we had to amend this between now and then, if something came down, we could amend the policy, correct?
Yes.
So is this coming from the state, Jay, or the feds?
The feds. These are federal laws. The state is involved there too, only because we have some state employment laws where OFLA works hand in hand with FEMLA. So it all comes together, but the Families First Coronavirus Response Act and the Emergency Paid Sick Leave Act are both federal laws.
But the Oregon Family Leave Act, that's state.
Yes.
All right.
I did have one other question on for one of the exceptions. I think it's on page 1. COVID-19 paid sick leave is not available for healthcare providers or emergency responders.
Yeah.
That inclusive of
I knew you were going to ask that because that's another one that the Department of Labor
right.
intends to give better clarification.
Okay, because I'm thinking about our law enforcement guys, and I can think of several of them right off the top of my head, that have kids and are going to struggle trying to make sure that there's care for their children, and what that's going to look like for some of our.
Yeah. So right now they consider emergency responders not your regular law enforcement, but again, we're going to get better clarification in the next couple days.
All right.
Other questions or clarification?
For the most part, that was my main curiosity was just as it pertained to law enforcement and emergency responders. But yeah, thank you.
Okay.
Yeah,
So,
good questions.
There is one other one. This basically is to, as we adopt this into our policy, this is going to cover all county employees, correct?
Yes.
Because I just want to make sure that we're also inclusive of the road department and things as well. I understand that they're not union, but this employment policy, I just want to make sure it was inclusive of that as well.
Yeah.
Okay.
This policy is basically a game plan to help us comply with these two new legislations.
same goes for the fairgrounds out there, James.
Right. That was another curiosity.
So one of my questions, Jay, about the only one I have is, so we've had a couple employees that have already went out for 14 days just to make sure, are we gonna be able to,
That's completely separate. What's happened in the past is in the past. On April 2nd, this law goes into effect, and we will put immediately 80 hours of COVID-19 leave into their sick banks.
so
That will be available.
they had to use their previous sick pay for those 14 days?
If they were sick, yes. If not, if it was admin leave, if we sent them home because we had a concern but they wanted to work, that's admin leave. We wouldn't be deducting from their sick bank.
Is there a statute on this? Like, how long does this sit in their bank for?
Until the
How
end of
many
the year,
months?
December 31st. So,
That's on this policy.
yeah.
Was that your question?
Yeah. I
And
just
who
wanted
knows,
to know.
we might still be dealing with it when the next flu season kicks off in November. We don't,
Let's all pray that's not the case.
yeah.
Well, we hope not, but it definitely shows to employees how important our insurance policy of sick leave is to have. You should really didn't think I'd ever see this, but most people really try to save their sick leave. This is an example when I read.
Yeah.
Really,
Yeah, so part of this law is to protect those people who don't have a lot of sick leave, and normally you're not eligible for family medical leave or until you've worked somewhere for 6 months. This gives them they're eligible after 30 days of employment, so they want everybody to be able to take time off if they need to.
So this is, I don't want to get into the weeds, as my fellow commissioner keeps that term frequently. I was on the OHA call this morning with AOC and Andy Smith, and we were listening to some of the things OHA is asking of businesses and local government, and one of them was that they are asking businesses not to require employees to get a doctor's note for being sick. And they obviously, we can ask for a doctor's note or
Yes.
something to that extent, but they're asking them not to because so many people are asking for those things that it's kind of flooding the system, so to speak. So under 3, we have diagnosis or treatment or written verification of the employee's efforts to receive a medical diagnosis or treatment if the employees experience symptoms. I'm curious if, because it says that the employees will be expected to provide verification of the need for COVID-19 paid sick leave.
Yeah,
And
really.
follows and it lists those off. So I would really like a little bit more clarification from the state as to what they're actually expecting us to, our employees to provide when they are asking for this sick leave. They're showing these symptoms. We just talked about it this morning. I think we beat that horse pretty hard, was our inability to test and get tests turned over. But if people are sick, they're sick. And so I think it kind of puts us into this weird place where we're asking them to verify, and get a doctor's note to a certain extent, but at the same time, OHA is saying that they don't want us asking employees for a doctor's note.
Yeah, really good point. So right now, we don't want to flood the system with these requests because there would be a lot of them.
Right.
But this policy and this law is going through the end of the year, so it's trying to anticipate the needs of employers to deal with this. So currently, you commissioners could take a more lenient stance. Brad had mentioned, even public health saying, you should stay home. That could be considered a diagnosis, recommendation of treatment.
James, that's exactly where I went sidebar with Jay before the meeting is nothing's normal, and so we're self-quarantining by recommendation of public health and our doctors. So I think our leniency in this is if Judy or people say self-quarantine if you're sick, we have to trust a lot of people. I don't think we're going to run into a lot of abuse. I think after we get through this next spike in the next 30 to 60 days, we may have to relook at this, but that's sort of where I'm at. If the board is comfortable with just trusting our healthcare, keep people from trying to get a note from the doctors is
Well,
where we need to be.
I don't think you're going, for one, I don't think it's gonna be possible.
Yeah, right.
Right.
What I was hearing from you guys in previous meetings was that you wanted to treat them or handle this in a very lenient way, not require that documentation at this point.
Well, and to all across our nation, world, is to slow this curve down, is to self-quarantine, social distancing and everything. So if we implement that you have to have a note, we're going against what we're trying to do. So
Right, because the whole trend is right now is to stay on the side of caution.
Yep.
It isn't necessarily go get yourself tested and find out for sure, because there's no way.
But a couple months from now, when the system is not under such pressure and somebody could see symptoms and
well,
you
Well,
might want to
And
be able
tests
to.
become available, faster tests and everything. That's the reason why I say this is going to somewhat be a working document.
Well, and the thing is that they're so limited on tests, they're not even testing anybody below the age of 60. And so how are you going to, they're telling them to go home and quarantine themselves if they have these symptoms.
Right.
So,
So,
Yeah, I'm comfortable with the document, we're getting a lot of mixed signals sometimes from OHA and others, so I'm just kind of putting that out there that some better clarification would be nice going forward. But I am comfortable with the document. I think Brad, you said it best, that this is gonna be kind of a living document for a little while.
just like our commissioner meetings and everything else.
well, the good conversation so that Jay, when people are coming to Jay, he knows from the board that we're not wanting to really hammer anybody and make them go get documentation. There's a trust factor here. We've talked 2 weeks almost now, is we have to put some trust into our employees and the public, and so.
Right, and if the employees are looking at this and they find something that lacks clarity, at least this way they know that, we saw the same thing.
Yep.
So, we're trying to work our way through it.
So unless there's other questions, we do need to have a motion and a second it's a COVID-19, sick leave policy, is that what it's called?
I must have,
Mark?
that's the policy name.
The other thing, I thought it was interesting that they called it at the top of the page, it said novel coronavirus, COVID-19.
Yeah, that's just what they've been calling it.
It's interesting that they would say novel. I mean, it's just a mutation of the coronavirus. It's been around for a long time. Flus mutate every year, and novel coronavirus. I find that kind of a strange term.
Wait, I think they pinned that on there just to clarify that we don't know a lot about this and things keep changing and it's very fluid.
So you ready for me to make a motion, James, or do you want to talk about novels some more?
No, I'm good. Go ahead. You were asking about the title, so.
I'm just giving you heck. All right, I'll make a motion to accept the novel coronavirus COVID-19 emergency leave policy.
Seconded.
Motion's been made and seconded to accept the coronavirus.
COVID-19 emergency leave policy.
So stated. Any further discussion?
Good for me.
All in favor, say aye.
Aye.
Aye, motion carries. I have nothing else to come before us, and I'm anticipating to go ahead and close the emergency session down for the rest of the being this Friday. James, do you anticipate any need the rest of the day for this to be open?
I do not, but kind of moving hour by hour, so
Yeah.
so far so good.
All right, so we will adjourn at 13 minutes after 2. Thank you guys so much.
Thank you.